The anatomy of compound lifts. In this module, we will look at the anatomy used within our main compound lifts. Along with knowing all the technical models of these lifts, we also need to understand the applied anatomy behind each exercise. So, if you're ready, let's get started. The squat. The squat can be seen as one of the most important exercises, as it calls on many different muscle groups to execute. The squat is a very popular exercise and is generally used as one of the measuring sticks to evaluate lower body strength. There is ample evidence describing its use for improving muscular endurance, power, hypertrophy, and strength. The main muscle groups or primary movers in action are the quadriceps and glutes. The quadricep femoris is the large muscle bulk on the anterior surface of the thigh. As its name implies, it is composed of four main muscles. The rectus femoris muscle, more commonly referred to as the recfem, has its origin above the hip joint, while the other three muscles originate from the shaft of the femur. Those muscles are the vastus lateralis, situated on the anterolateral aspect of the thigh, the vastus medialis, situated on the anteromedial aspect of the thigh, and the vastus intermedialis, situated between the vastus medialis and vastus lateralis, lying deep or underneath the rectus femoris. The quadricep muscle group is the main extensor of the knee joint. Each muscle within the quadricep appears to have a particular role in knee extension at different ranges of the movement. As the main knee extensor, we can see why the quadriceps femoris are a primary muscle when discussing the squat movement. The other primary muscle in the squat movement is the gluteal maximus, or most commonly referred to as the glute max. The glute max is the most superficial gluteal muscle. It is the largest, heaviest, and most coarsely fibered muscle of the body. The main actions of the glute max are extension and lateral rotation of the thigh. Although it is the strongest extensor of the hip, it acts mostly when force is necessary, rapid movement or movement against resistance. The glute max functions primarily between the flexed and standing positions of the thigh, as when performing a squat. The synergist muscles or fixators within the squat movement are the hamstrings, adductors, erector spinae, and calves. A synergist muscle is a muscle that enhances the effectiveness of the primary muscle, generally by stabilizing the origin of the agonist muscle or the joint in which the movement is occurring. These muscles assist the primary movers to complete the movement competently. The muscles within the trunk will work to stabilize, and they include the transverse abdominis, multifidus, internal and external obliques, and the rectus abdominis. The deadlift. The deadlift is the next exercise we will look at and discuss which muscle groups are primarily in action when performing the movement. The deadlift differs from the squat in that it is a hip-dominant movement pattern, meaning the muscle activation is predominantly posterior chain. In the squat, we simultaneously break at the hip and knee, whereas in the deadlift, we try to push the hips back first. This makes the movement mostly hip extension. This means the primary movers of the deadlift are the glutes and hamstrings. Although the deadlift is seen as a posterior muscle group movement, the quadriceps are also a primary muscle group in the deadlift, with most of their recruitment happening at the first pull phase from the ground. The glutes are active from start to finish when performing the deadlift, but work primarily to straighten the body when the load comes approximately knee height. The hamstring muscle group is made up of the semimembranosus, semitendinosus, and the biceps femoris. They are the large mass of muscle that make up the posterior thigh and are involved with extension of the hip, flexion of the knee, and rotation of the flexed knee. If they contract with the lower attachment fixed, they will assist the glutes with hip extension as seen in the deadlift. The deadlift can be classed as a full body movement as there are several other muscles in action during the deadlift. The latissimus dorsi and trapezius muscles work isometrically to stabilize your torso during the movement. Much like your lats and mid-back, your erector spinae muscles will work to keep your back straight and stable, encompassing the whole core control aspect along with your abdominals. The forearms, rhomboids, and serratus will also be active throughout the movement. The bench press. The bench press is the first of our upper body push exercises that we will discuss. The bench press can be defined as a horizontal upper body push exercise. It is a very popular exercise and is generally used as one of the measuring sticks to evaluate upper body strength. There are many variations to the bench press, but for the sake of this module, we will focus on the traditional barbell bench press. The barbell bench press is a compound, multi-joint exercise designed to target many muscles in the upper body. During the eccentric phase, the body goes through shoulder abduction and elbow flexion, and during the concentric phase, the body goes through shoulder adduction and elbow extension. The primary muscle in action with the bench press movement is the pectoralis major. The pectoralis major is the largest and most superior muscle of the anterior chest wall. It is a thick, fan-shaped muscle that lies underneath the breast tissue. There are two heads of the pectoralis major, the clavicular and the sternocostal. The pectoralis major mainly adducts, medially rotates, and transversely adducts the arm at the shoulder joint. It assists in flexion of the arm via its clavicular head and assists in extension of the arm via its sternoclavicular head. Two synergist muscles of the bench press movement are the anterior deltoid and the triceps brachii. Other muscles that are important within the movement are the muscles that aid in stabilization during the movement, and they are the abdominals, biceps brachii, and the rotator cuff muscles. The overhead press. The overhead press is the second of the upper body push exercises that we will discuss within this module. It can be defined as our vertical upper body push exercise. As this exercise is performed in a standing position, it is necessary for the body to maintain control from the feet up and seize many stabilizing muscles in action throughout. Maintaining proper technique is particularly important with this movement pattern. Much like all the exercises we are discussing, there are many different variations that will slightly change the muscle activation. But for the purpose of this module, we will look at the strict overhead press, also known as the military press. The primary muscle used in the overhead press is the anterior deltoid. The deltoid muscle group encompasses the anterior delt, middle delt, and posterior delt. As mentioned, the anterior deltoid is mainly used when flexing the arm at the shoulder or raising your arms out in front of you all the way overhead. The middle deltoid, also known as the lateral deltoid, contracts to abduct the arm laterally as well as assist the anterior deltoid movements. The posterior deltoid, also known as the rear delt, assists in moving the arm backwards into a retraction-type movement. Think of exercises like face pulls and imagine the muscle bulk on the posterior aspect of the shoulder. The middle or lateral delt, the triceps brachii, and the pectorals are the synergist muscles within the overhead press movement. These muscles assist the anterior delt in completing the exercise effectively and will gain benefits with progressive overload of the movement. The triceps brachii is a large, thick muscle on the posterior aspect of the upper arm. It gets its name due to its three muscle heads or points of origin: the medial head, the lateral head, and the long head. The triceps' main function is extension of the elbow joint. As briefly mentioned above, the overhead press requires the body to use stabilizing muscles throughout the whole body, including the upper and lower body. The list is extensive. The main stabilizer muscles to mention are the stabilizers of the shoulder joint itself, and they are the trapezius and rotator cuff muscles. The bent-over row. The bent-over row is an upper body pull exercise. The bent-over row can be defined as our horizontal upper body pull movement. The bent-over row is an excellent exercise for developing strength endurance, hypertrophy, or even maximum strength qualities in the back. It is important to emphasize pulling movements when programming so structural balance is achieved. It is also important to note that having a strong back or pull phase can in turn strengthen your push movement and vice versa. Having weak antagonist muscles may limit the velocity at which contractions are completed, so strengthening antagonist muscle groups can in turn strengthen agonist movements. The setup position for the bent-over row will require mobility and strength in the muscles of the trunk and legs. If the positioning of the movement is too difficult, the exercise cannot be performed effectively. As such, there are always regressions we can implement while still targeting the primary muscles of the movement. The primary muscles of the bent-over row are the rhomboids and the latissimus dorsi. The rhomboid muscle group is split into the rhomboid major and minor. The main functions of the rhomboids are to retract, elevate, and rotate the scapula. We include the rhomboids as primary movers in the bent-over row because retraction of the scapula is imperative when performing an efficient bent-over row. It is the first movement during the pull phase and creates good positioning before the lats take over and contract optimally during the exercise. The latissimus dorsi is the broad, flat muscle with several different attachments, including the lower 6 thoracic vertebrae, the thoracolumbar fascia, and posterior iliac crest, to name a few. More importantly, when discussing the bent-over row, the latissimus dorsi inserts into the bicipital groove of the humerus. This insertion means that the latissimus dorsi is active in extension at the shoulder, much like we see during the bent-over row. The bent-over row requires good movement competency to complete effectively, but it is an important exercise to strive for. It creates tension throughout the body to maintain the position and works multiple different muscle groups in doing so. The trapezius, biceps brachii, and posterior deltoids all assist in completing this movement, while the erector spinae and transverse abdominis maintain stability throughout. The pull-up. The pull-up can be defined as a vertical upper body pull exercise. It is a very popular exercise and can be used to evaluate upper body pulling strength. The movement itself incorporates many different muscle groups and works mainly the posterior aspect of the body. The primary muscle used in the pull-up is the latissimus dorsi due to its size, action, and attachments. Along with what we previously discussed, the latissimus dorsi is also active in moving the trunk forward and upward when the upper extremities are fixed overhead, linking the exact movement pattern of the pull-up. Although most of the back muscles are in action during the pull-up, the main assistance muscles are the lower and middle trapezius, rhomboids, teres major, and biceps brachii. The rotator cuffs, teres minor, abdominals, and triceps are some of the stabilizing muscles within the movement. The above is regarded the conventional pull-up movement, with pronated grip or overhand grip, just outside the shoulder with holding a stable hollow hold throughout.